Hello, my name is Dr. Dilip Nair. I'm one of the epilepsy physicians here at Cleveland Clinic. What is a seizure? A seizure is a symptom that occurs in a patient who has epilepsy, and it's resulting from an abnormal electrical brain discharge. Your brain is what makes you the person that you are. It allows you to talk, it allows you to function in the ways that you do on a day-to-day basis. And you can imagine that if an electrical storm were to be happening in your brain, that function would be disturbed. And in fact, epilepsy is a disease of electricity in the brain. What does a seizure look like? Some seizures are quite prominent, and most people will recognize them if they were to see it. That type of seizure has been called grand mal seizure, or some people call it a tonic-clonic seizure. And these are seizures in which patients lose awareness, they may fall to the ground, their body may appear to stiffen and jerk violently. However, seizures can also be as subtle as a simple stare and unresponsiveness. Abnormal movements can occur, such as twitching of one side of the body, abnormal chewing movements in which the patient appears to be unresponsive with what looks like automatic movements. The vast majority of seizures are less than 2 minutes in length. When a seizure is lasting longer than 5 minutes, that's a neurological emergency that we want to get control of as quickly as possible. What causes a seizure? In epilepsy, there are two main divisions. One is what we call a generalized or genetic epilepsy, where the seizure disorder is not specifically located in one part of the brain per se, but it's rather more deep in the brain. And so the electrical disturbances are generalized in a sense, where the electrical storm that's occurring is seen all over the brain simultaneously. And in that category of epilepsy, you can have tonic-clonic seizures where you can stiffen up and jerk, or you can have seizures where you suddenly just have an arrest of behavior and you look absent, or the so-called absence seizures. Another type of epilepsy is what we call a focal epilepsy, where there's one part of the brain that's giving rise to the epileptic seizure disorder. And depending upon that location where the seizure onsets are occurring, it can manifest in different types of symptoms. The history and the seizure symptomatology can inform where the seizure focus might be originating within the brain. When should you see a doctor about seizures? All patients with epilepsy will see physicians and neurologists particularly to try to see if the diagnosis is accurate, number one, and are they on appropriate treatment. Having said that, if your seizures are still occurring despite being on anti-seizure medications, it's really important to seek care from a specialist that might be able to help you figure out other opportunities to get your seizures under control.